Hello, and welcome to the Tips with Toni podcast. I'm Toni Marinucci, your registered dietitian, helping you get healthy one bite at a time. I am so excited for this next interview, and I know I say this all the time, but I'm genuinely very excited. So I have virtually in front of me Dr. Brittany Kraft. She is a doctor of dental surgery and obviously a dentist. However, she's also a childhood peer of mine from high school. That we grew up in the same town. We went to the same high school. And Brittany, I'm going to have you introduce yourself in a second. But I do want to just let you know, I think we had home ec together. And Brittany was just always she was the sweet, popular girl. And because she was popular, I just felt automatically intimidated. But she was just so kind and so sweet and just made me feel just like a friend, like a peer. I didn't know, I no longer felt intimidated. And I just because we put these stories in her head, it's ridiculous. I was what, at middle school, or was it high school? We were 10 and we were 14, maybe. I don't know. Anyways, Brittany, I just want everybody to know that not only is she good at what she does as a dentist, but she's a very kind, sweet soul. So I'm very excited for her to be here. Yeah. So I wanted to I was going to tell you that before we started recording, but I was let me just save it. Let her know.
That was, first of all, I am this ultra nerd. So that's so funny. And, I just have to say that, I've been following you on social media. I guess probably since college and into dental school and to this day. And honestly, it's so amazing to kind of see your growth and where you started and how you've grown that. And I had, an assistant email me to confirm, and I was like, wow, okay, she's got it going. So I'm so proud of you. I really am. And, from day one, it was almost like you didn't care what other people thought. You had a vision, and girl, you're reaching it. So I'm proud of you.
Oh, thank you so much. That really means a lot to me. But you need to, I know you have every reason to be proud of yourself as well. So you just started your own practice, right? So tell us more about that. We went a little, we'll go back to the questions in a second, but tell us more about, tell us more about your practice and kind of going after that. And did you envision yourself having your own private practice when you were in school?
Yeah. So yes. Hi, everyone. I'm Brittany, or Dr. Kraft, I go by. And I knew Toni. I grew up in Long Island, and I went to Syracuse for undergrad, Buffalo for dental school. So I lived upstate for 8 years, survived the winters. I met my husband right at the end of dental school, and he grew up in Fairport, New York, which is Rochester area. I did my residency training in Connecticut at Danbury Hospital for a year, and then I moved my way back upstate. And yes, further than Westchester, Rochester is we're right near Canada, is our neighbor. So it's an amazing place to be. And I worked as an associate for since I was in private practice since 2017. I've always wanted to own, and the two practices I worked at, I learned so much from. They were very different. And, as time went on and I gained my speed and confidence, and, I was ready. And it's so much more than just one tooth at a time, but, being a part of the local community and working with an incredible team of people who just seeing them personally and professionally, succeed and grow together is the most rewarding thing. So I've now own a practice in Pittsford, New York. It's called BC Dental Design. And I started on March 1st. So it is very new. It is late nights, a lot of hard work, but I was always up for the challenge. So at the end of the day, I would do it all over again and again and again. So it's been an amazing, humbling, incredible experience. Lots of hard work, but it's been awesome. So that's kind of me in a nutshell in my dental world.
That's so exciting. That's so exciting. I'm very excited for you. You're a month in, you're about to enter your second month. The first year of business is a whole lot of figure outables. But everything is figure outable, but it's a whole lot of figure outables.
I don't know if my acting skills got really good, but internally sometimes you're just oh my God, but you got to go in and just, you got to keep your cool and stay calm and just do the best that you can, and I continue to do what I love, and I'm committed to that. So
That's awesome. That's
And so,
awesome. So what made you decide to get into becoming a dentist? I feel like
so
that's not always the
I
first
got it.
thing that like someone, like a kid's not like, I want to be a dentist when I get older.
I know. Well, I hope no one turns this podcast off right now, but I've never had a cavity. That's a
Ooh.
start. So my experiences were always good. I know a lot of patients, may have not had good experiences when they're young. I've heard so many stories. So
Mhm.
that's probably a start. So I stay tuned, guys. This will we'll talk more. But no, I had, and I think sometimes a lot has to do with, just your genetics and some,
Mhm.
I always cared about that stuff. And, when
Mhm.
I loved my dentist in the office. And I got to show you a picture, but it's a picture of me in elementary school in my yearbook. And underneath the picture says what you want to be when you're older. And under my picture, it said dentist and actress. So obviously
Shut
the
up.
acting didn't work
Okay.
out, but,
And I was making a joke, but you really did.
I
That's
know.
crazy.
And I actually, I always had it in the back of my head. My dental office, the hygienist sent me home with like a real mirror and a real explorer. So I'd go home and practice on my dad and my brother. So that's why, it's so important to me for my patients to like, especially the young ones, to give them a good experience because it was a big reason, it got me here, but so much more. I always knew I wanted to go into medicine and I explored many different professions. And at the end of the day, when I started shadowing and interning, in high school and in dental school, I loved how the doctors, had this really amazing, like they built this trusting relationship with their patients. And it's amazing to you see them for years and years and hopefully, and
Mhm.
you build this great relationship and you be a part of their family and a bigger part of the community. So not only
Mhm.
are you helping these patients, but at the end of the day, you're creating this bond that is just, it's so incredible. It's hard to explain until you're in it and you're doing it. And I always welcome if there's anyone interested and they want to shadow. It helped me and encouraged me. So I'm always open to that too.
Oh, that's great. Yeah, definitely. Anybody who's listening, if you or your child is interested in becoming a dentist and you live in the Rochester area, or if you just know of a dentist in your
Call
area,
me.
like,
I'm always happy.
yeah, seriously, seriously. I mean, that's like very important, I think, if you're thinking about a specific career path, to shadow that person and make sure.
Yeah, and
That's always
explore
great.
and yeah, highly recommend.
Awesome. All right, great. All right. So I wonder if people, I feel like maybe someone's like, yeah, I get it. Why, you would have a dentist on your podcast. Like maybe if you eat too much sugar or candy, you get cavities and that's why, but like, that's not why, guys. I believe in overall health, well-being from head to toe, spiritually, physically, mentally, emotionally, and your dental hygiene really does show whether it's symptoms. Like there's a lot going on in your mouth that I don't think people recognize. So that's why I wanted to bring an expert on here. So Brittany, do you mind just sharing maybe what someone's oral health can say about their physical health? Like what are those kind of signs and symptoms that is either like a good sign or maybe there might be something underlying going on?
Absolutely. So, two things. One, I can nerd out. So if I'm going on too long, just let me know. Um, and two, before I'm going to dive into that, I just want to bring up, talk a little bit about gingivitis and periodontal disease or periodontitis.
Sure.
Just as we talk about, I want to make sure people, can differentiate. So gingivitis is, inflammation of the gums. You have what's called a plaque, which is like a sticky material that sticks to your teeth lots of times between the teeth and along the gum line. And that plaque is really bacteria and it's releasing these acids that your gums don't like. So it kind of creates this inflammation. And with that, causes that bleeding gums. When that plaque continues to stick on your teeth, it over time starts to harden into what's called calculus, which is now like a hard deposit. And flossing and brushing is actually not going to get that off your teeth. That's when you need to see your hygienist, and they use special instruments and techniques to clean that off. So Gingivitis starts as more of just a gum inflammation. There's an irritant, your gums don't like it. And then it can lead to this calculus, which now your gums and your bones around your teeth don't like that. So that leads into what's called periodontal disease. It's a disease, it's an inflammatory disease. Any patient at any age can get this, even, teenagers or, young 20s. Everyone can get this if they're not seeing their dentist twice a year. So just to differentiate, gingivitis can lead into periodontitis. So when we talk about these things, and let me know if you have questions regarding that. So going back, what does someone's oral health say about their physical health? What's interesting is actually patients more commonly see their dentist than they do their own primary care doctor. So they have really, throughout dental school and residency, they teach you to really understand overall health, because there's a lot of things that we can see during an oral examination that may, lead us to say, hey, listen, go see your primary care physician, go see an ENT. So a couple of major things to just touch base on: patients with diabetes and cardiovascular disease. There is so much research linking your oral health and your risk for diabetes and cardiovascular disease. So you're at a higher risk if you're a diabetic, especially an uncontrolled diabetic, you're at a higher risk for periodontal disease. You're more prone to developing infections in your mouth. And then if there's an issue, slower healing process. In addition, it's common, to sometimes see what's called thrush, which is a fungal infection in the mouth too. You can get red or white, those are red or white patches on the roof of your mouth or your tongue that is very sore and tender. Cardiovascular disease, periodontal disease, which we talked about, is that kind of that long-term chronic inflammation in the mouth, leads to you're at a higher risk for cardiovascular disease. That you have good bacteria in your mouth and you have bad bacteria. That bad bacteria, as you're brushing and eating, now as you're swallowing, it's getting into your systemic health. So it's all interlinked. So it's so important to make sure you're seeing your dentist to evaluate some of these things. In addition, the periodontal disease can exacerbate the existing heart conditions too. So in dental school and also in private practice, the Panorex X-ray machine that we take, that will show us not only, your teeth, the roots, your jaw bones, your sinuses, but we can actually see if there's a clogged carotid artery. And twice I have diagnosed that and sent the patient, to the specialist to get that evaluated. And they found out, one needed a stent. And so it's just, and like I said, they don't see their primary care physician. So we're here to help them, guide them to get the professional help that they need. We have immunocompromised patients with osteoporosis. Another, I would say a lot of studies going on now are sleep apnea, patients with enlarged tonsils, patients who have not had orthodontics when they were younger, who have their upper palate is more narrow and there's not a lot of room, for it affects their airway. Sometimes, enlarged tongue, all these things, kind of when we're looking at this stuff, we're able to ask these kind of questions. So interesting, children too a lot of them are diagnosed with ADD or ADHD. Lots of times they just have airway issues and, they get put on this medication because they have poor behavior, but really they're not getting, proper oxygen. They're not getting proper airway, I should say. And it's causing the wet bed. Yeah. So it's I would say more, there's a lot more studies on that now, but again, these things as a general dentist, we see a little bit of everything. We treat all ages. So yeah. And then lastly, I was trying to think, things about, diet. I've diagnosed a lot of patients with GERD or acid reflux that didn't know that they had it. You see these it's called erosion. So it's the enamel of the teeth, which is that outer protective layer, starts to erode because of the acid from the acid reflux. So there's been undiagnosed acid reflux when we see those types of patterns. And then lastly, patients with history of bulimia or even current bulimia, the acid content from the stomach
Mm-hmm.
can erode the teeth and the enamel, and it weakens the teeth. It causes tooth sensitivity, and they're more prone to decay. And over time, it can create cosmetic issues too. So,
Yeah. And thank you for sharing that one, because that is definitely, my main clientele I work with, a lot of the clients have either struggled with or, mostly in the past, they've grew up with like an eating disorder, disordered eating
yeah.
behaviors, and some have experienced, going through that binge and purge cycle. And, it's can be a hard thing to recognize, like, obviously we know like our mental health is compromised by staying in that cycle, but like you really can, we forget about the physical damages that can also happen, and to lose our teeth, like
Yeah,
it's just really,
absolutely. Yeah,
man.
it's hard. It's, and I've seen both ends of that. And but just being there and educating them, that's what we're here for. And
Yeah.
then lastly, of course, oral cancer, especially in patients who are smokers. So again, it goes back to how important it is to make sure, see your dentist, twice a year, every 6 months. And we do a thorough, oral examination and cancer screening. So very, very important to, make sure to get things checked. If there's a sore in the mouth, you need to go and get it checked.
Definitely. Definitely. So, okay. So let's go back to like the beginning and just like where you were saying with like gingivitis and how it can kind of lead to periodontal disease.
Mhm.
Like I feel like, all right, guys, let me just tell you this. So anybody who's listening, first of all, I have gingivitis. It's really not one of my proudest things to have been diagnosed with, but I work really hard on flossing, and I'm not gonna lie, I was never a flosser. It was one of those things where like kind of like when my parents would be like, save your money, learn that the hard way. Like didn't start saving my money until later in life. Like nothing kind of clicked for me. And now it's like, oh, okay, like this is really important. So I've been like super adamant about, flossing and using mouthwash. And I have like receding gums. So I brush too hard. So instead of like a regular toothbrush, I got the electric toothbrush. So I'm like really trying. So first of all, anybody who's listening, no shame. Like if you struggle with this, like you're not alone. But like honestly too, like I feel like a lot of people don't floss their teeth. Like, am I alone? Like I just don't think that I'm alone in that. So
I know
like,
whenever I ask, do you floss your teeth? Yes. How many times do you floss? That's when it ends up being.
and I really am I'm like a people pleaser. So I'm like to let, like when my dentist asks me like how often I floss, they say like most of the time, but that's not most of the time.
Yeah.
Like, so just so you know, Brittany, like I know I've had like clients in the past that probably have lied a little bit. It's, we're just trying to like, make you
Yeah,
proud.
we get it. We appreciate the honesty. We're just there to remind you again. I feel like
Oh,
even
God.
if you were the perfect flosser, we would never be like, everything looks perfect, because then you start slacking. So we're like, oh,
Yeah.
focus on this one area you may have missed.
But it really is, it does, I feel like comes down to like accountability, because like you said, you go to your dentist twice a year, which is more than like your regular doctor, but still it's like every 6 months. So like I might be really great and remembering like right after my dentist, and then I start to slack off. What I'm learning to do is like, where I would like slack off and then it's like, oh God, now my gums are bleeding again. It's like, all right, if I slack off, I know now that if I slack off for too long, my gums are going to start bleeding again. So I really have to just like, I have to just be
It's
my own best, like, team, like advocate and teammate, and just like cheering myself on. But like, can you talk about maybe some tips for flossing, or talk about the importance of flossing, and like, how do we get into a routine or a rhythm so we
yeah,
actually do it?
absolutely. So I know I don't know what it is about flossing that people are just like, I don't feel like doing it. But we get it. We're all human, and it's, life happens, but it just has to become a habit,
Yeah.
and just like you wake up in the morning, you maybe make your bed and you wash your face, or you use the restroom, you drink a glass of water. It just has to become a habit. And I always
Mhm.
tell patients, if they don't really floss ever. It's a lot, to be like, okay, floss, twice a day or floss every day,
Mhm.
and they floss maybe once a month. So I say, listen, baby steps. If you can just, promise yourself and do it, maybe pick up at 2 days a week, and if you
Mhm.
can do it 3 days a week, start there, commit to that. They say it takes 30 days to get, into a routine. I think, what is it, 60 or 90 days to create a habit. So
Mhm.
it takes time, and
Mhm.
especially you're exhausted. So I tell patients, listen, floss at the end of the day, throughout what you're eating, because sometimes patients floss in the morning, but I don't want you to sleep and if there's food stuck between your teeth, you don't want that to stick there. So
Mhm.
another option, so there's different kinds of flossers. Honestly, the string floss is the best.
Mhm.
We explain to our patients what's called C-shaped flossing. So some patients like, I do floss every day. I don't know what I'm doing wrong. The up down motion is just not enough. You have to
Mhm.
floss down and create a C shape around the tooth and hug the one tooth in the front, hug the one tooth in the back. That allows the floss to get underneath the gums a little bit more, and that's where that plaque likes to hang out. So
Mhm.
that C-shaped flossing with string floss is the best. If there's some flossers that have the pick, so you don't have to wrap it around your finger, again, just try to keep that pressure against one tooth, and that's very helpful.
Mhm.
There is what's called a water pick. It's water PIK. Um, it's a water flosser. I say it's a great addition, but it's not to replace flossing. I think it has a different function. It's like a power wash, just to kind of, you can do half Listerine, half warm water, and you fill up the tub and then it just jets out water. They have cordless ones now. I have patients who buy it and they bring it in the shower with them, whatever floats your boat. Um, but I say, it's sometimes more fun or it's more refreshing. So maybe you alternate that and then and then using the string floss too. So every patient is different and customized to what your needs are. So I kind of give these options to them. Regarding toothbrush, Oral-B and Sonicare are electric toothbrushes, and the ADA recommends it. They're good toothbrushes. What I love about them is they run a full 2 minutes. And I think you realize that you don't really brush the full 2 minutes. It does feel like a long time, but
Yeah.
when it's the full 2 minutes, you're really focusing on all surfaces of your teeth throughout your whole mouth. And then soft bristle toothbrush, I recommend. Hard bristle is aggressive on the gums, so I don't recommend that. It's not about applying a lot of pressure to clean your teeth. It's just brushing twice a day for the full 2 minutes.
Mhm.
So those are little tips and tricks. And honestly, when your gums are bleeding, um, it's because it's inflamed.
Mhm.
So getting into that flossing habit, don't be discouraged. That bleeding will slow down. And I'm sure you can speak on behalf of that. The more you do it, your
Yeah.
gums are responding. They're not inflamed and they're healthier. So that's good.
Yeah,
Um,
definitely.
yep.
There's a significant difference when I'm flossing regularly and when I'm not.
Yeah, exactly. And it's just, depending on diet, there's so many things, so many factors, but if you commit to those things, you're going to be on a better journey to, good oral health.
Mhm.
Other, tips and tricks, tongue scraper too is a nice option if just talking about different routines to help with bad breath. So tongue scraper is really good. Lots of hydration, staying hydrated is also really good too.
Great. I didn't know about the water pick. Definitely going to explore that.
Yeah.
Is a tongue scraper different than if you just brush your tongue with a toothbrush?
Um, Brushing your tongue with a toothbrush is good. The tongue scraper is if you tend to get more buildup on your tongue. So if you were to stick your tongue out and look towards the back, you might see like more of like a white film. So the tongue scraper is just literally scrapes that off. But if you are consistent with using your toothbrush, that's good too.
Cool.
Yep.
Great. Awesome. All right. So I feel like another kind of diagnosis or something that could be related to oral health, I guess we'll talk about it, is like that I think you didn't mention, but I know that it's common, like any like GI or like gut issues, right? Is that, have you noticed that like maybe they'll have bad breath, or is there something that you can notice or identify when it comes to oral hygiene, and like maybe someone has like celiac disease or any sort of like IBS or some sort of like gut bacteria that could be causing the bad breath or issues with their oral hygiene?
Yeah, absolutely. Like I said, everything is kind of connected, but
Mm-hmm.
there are, lots of times it's like the undiagnosed acid reflux or GERD.
Mm-hmm.
That's pretty common too. But
Mm-hmm.
I would say the biggest factor of bad breath really is just that bacteria that's in your mouth, that plaque or calculus, that causes the gum inflammation and kind of hides out, between the gums and the cavities too. All these things can cause the bad breath, but absolutely, your diet is a big factor. If you, depending on what kind of foods you eat, there are certain foods that can, that from your stomach can cause the bad breath.
Mm. Do you want to maybe speak to like, is it a
Garlic,
certain?
obviously,
Oh yeah,
yeah.
yeah,
So, and I don't have like a full, I don't want to say a full list because I don't know all of them, but garlic is a pretty, a common one. So,
yeah, yeah. Okay, good. Yeah, I don't want to really create any like food fear or anything like that. Anyway, so
yeah, yeah,
I feel like as long as you're flossing your gums, flossing your teeth, doing the tongue scraping, like brushing your teeth for 2 minutes. I mean, honestly, that's another thing that, listen, my dentist is awesome. I would, if I live closer to you, I would go to you. I'm very grateful. Like my dentist here in Pelham, shout out to Dr. Baskin. Like he's amazing. Like he's very thorough. He like takes a holistic approach. He like tells me all the things. And I'm like, Dr. Baskin, like, I am not brushing my teeth for 2 minutes. Like, just like I'm not really flossing as much as I'm telling you I'm flossing.
yeah,
like,
exactly.
it's a long time when you're just trying to like start your day.
It is. It is. That's why I say, if you can do something in the morning and something different at night and just,
Yeah.
find what's right for you. We can recommend patients to come to see us every 4 months instead of 6 months if they find that, they're more prone to picking up stain and things
Yeah.
like that. So it's
Yeah.
really, it has to be customized to what your needs are.
Yeah.
Yeah.
So that's a good point. Speaking of stains,
Yeah.
like, like tell it like how does somebody get stains on their teeth? Is that because like they enamel has been eroded? Is it because of like because they have that plaque? Like, is it because of certain foods or beverages? Like, what causes stains on their teeth?
Some patients are just honestly more prone to it, but I think a lot goes back to diet. I tend to see patients who heavily pick up stain from if they're heavy coffee drinkers,
Mm-hmm.
tea, wine drinkers, smokers. And, in addition, patients who have more of like a dry mouth too tend to pick up more stain also.
Mm.
So, and some stain sits it collects on the plaque on the teeth too, but that kind of hard stain a lot has to do with diet. Patients who are heavy coffee drinkers, I usually say try to alternate with water just to kind of help flush and so that that stain isn't sticking on your teeth. uh,
Mm-hmm.
so does that answer your question?
Yeah, definitely. Definitely. Does it have to do like if you like I've heard a couple things. Like I'm thinking of like the enamel on your teeth. I've heard when you don't have enough enamel, then you're more prone to stains. Is that true?
Oh, so well, maybe this is what you mean. So there's some patients who, so you have your enamel, which is that outer protective layer. That
Mm-hmm.
second layer of tooth structure is dentin, and it tends to be like a more yellow color. So patients who have gum recession, or just really hard, they really brush their teeth. You can actually wear away your enamel. It's called toothbrush
Mm.
abrasion, where if they use a hard bristle toothbrush or apply a lot of pressure, they wear through the enamel and they now expose the dentin, which is that second layer tooth
Ah.
structure, is a little bit more yellow or brown. It's more prone to stain, more prone to decay, and it's a softer, it's not that outer protective layer, it's softer. So as you're continuing to brush hard, you then create these notches, and then again, it just kind of keeps collecting the stain. So sometimes patients think they're, oh, I'm prone to stain, and it's like, nope, you're just exposing the dentin of your tooth.
That's a great clarification because I
Yeah.
didn't know that. I didn't know that. And I guess then my second question to that is doing teeth whitening
Mhm.
something that is like good for your teeth? Because like are you adding more enamel or I've heard it's like bad, you're taking the enamel off. Like tell us the truth. What's
Yes. Yeah. So one, so the tooth whitening, one, I usually recommend using like something professional, whether it's ADA approved or in your dental office. The idea of whitening is you have pores in your teeth, and that's where the stain collects in the pores. So it opens up those pores and helps flush out that stain.
It's like getting a
So,
facial. I'm
yes,
loving
exactly.
this right now.
Right. So it's a facial for your teeth. So it opens up those pores, but if, patients are sensitive because those pores are open and those pores go in towards like the nerve of the tooth. I'm trying to simplify it. So that cold water, it's just you're kind of more exposed, I guess. So
Yeah.
that's what causes it's not because it's taking away the enamel. But this leads me to another point. If you go on Facebook or Instagram, there's so many like new in, oh, try out this toothpaste, and they show you befores and afters, and using this toothpaste and it makes your teeth really white and gets all this stain off. If there is a colleague of mine actually did a little experiment in her office. She put the toothpaste on the toothbrush and she brushed it's like a cotton roll with like a tinfoil on top of it that's sealed. So she brushed that for 30 seconds, rinsed it, and the tinfoil was just sheared off. And if you look at the ingredients of the toothpaste that was being promoted, it was popular on Facebook. It actually had silica in it, which is like a glass. So it actually literally started that wears away your enamel, and that is not good. So that's why I say be really careful with a lot of these toothpaste and at home whitenings. You have to do
Oh
your
my
research and be
God.
careful. She did the same experiment with regular Crest, or I can't remember, it was probably Crest toothpaste, and everything was intact. So it was just
Wow.
perfect. That really stuck with me, and I have to give her a shout out, Amber. I'll let her know because I was so, just, you really have to be careful, what you're buying. And the charcoal toothpaste, I don't, patients ask me about it, and I don't love it because it's again, your teeth look white because it's pretty abrasive. So I worry, what are the true ingredients in that? And is that wearing away your enamel? So
Mm-hmm. Okay. I'm like
keep
fascinated.
that up.
I'm feeling one thing's going on in my mind right now is like, who would have thought dentistry could be like diet culture? Like there's so much BS out there. And you just have to like
Yeah.
sift through it and figure it out. Like did not know this was the case here.
And enamel doesn't grow back. So that's why I always just be careful with things like that.
Enamel doesn't grow back.
No. Mm-mm.
That's important. That's important. So I guess what toothpaste do you typically recommend?
It depends on the patient. I am a huge promoter of Sensodyne toothpaste, just because one, it's very gentle. There's an ingredient in a lot of toothpaste. It's sodium lauryl sulfate, and it's that ingredient that causes that foaming in a toothpaste that patients like, oh, I feel so fresh and clean. But it's a little bit abrasive. So that's why usually bleaching, toothpaste, one, they have a peroxide in it, so that causes it to bubble. But this ingredient can be a little harsh on the teeth and can cause sensitivity. So Sensodyne, I love it. It's much more gentle. Patients, some patients react to some toothpaste. They may get like sores in their mouth. So Sensodyne is kind of my go-to. I use it myself. It doesn't have that foaming action, so patients don't think it like clean, feels clean, but it's doing its job. It takes about 2 weeks to actually really start working. So you have to be patient with that too.
Okay, awesome. And then the last question about toothpaste, and then I have a couple more questions. We'll start to wrap up. But sorry, I have a lot of questions because I deal with this myself, and I'm sure the listeners. I hope you guys appreciate this. If you are, let me know. Or if this was just a very selfish episode, that's fine too. I'm excited. But like I feel like right now, what's very trendy is like natural hair products, natural dental stuff. Like, so there are also like, and I don't want to like say specific brand names, but like there are certain like toothpaste out there that like are promoted as like supernatural. And the way that I envision that, I don't know. And I'm curious your thoughts, but like sometimes like something will put like, it'll say organic on it, but it'll be like organic Lunchables. And like, it's like how much healthier is that? Or like organic lemon. Like you can have your Lunchables, you can have your lemonade, but it's not healthier because it's organic. You know what I mean? So I guess, is that the case with toothpaste, like these toothpaste or any kind of like dental marketing claims, like with these natural remedies, like are they something to be trusted?
I really, it's a lot of these natural toothpaste don't have fluoride. And let me tell you, I've seen cases where, patients either A, they didn't grow up with fluoridated water, or B, they don't use it, or they don't use it for their kids,
Mm-hmm.
and it's not good. So if you want to, fluoride is really, really important for your teeth. You get a lot of it naturally just in your drinking water with cooking. So, but having that source of fluoride is really essential to
Mm-hmm.
protect your teeth long term, prevent cavities, because like I said, I've seen cases where it's true, how not having fluoride and how that affects your teeth and the amount of cavities. And it's so do your research.
Mm-hmm.
Safe to say anything that, it has the ADA, which is American Dental Association label on it, you are good to go. There's been a lot of research on that stuff, but a lot of the organic ones, just be cautious if there's no fluoride in it. Make sure you're getting some sort of fluoride, whether it's Act mouth rinse is a fluoride mouth rinse. So if that means, you can alternate with that, just make sure you get your source of fluoride.
Okay, good.
Yeah.
Glad I asked that question. Okay, so I also so I have had a client who, we're working on her water consumption and also like decreasing alcohol consumption. And so one thing that I'll recommend is like maybe having like a seltzer, to help with your water intake when you're not really in the mood for water, but like you also, are just in the habit of like drinking, but like really you just want to maybe yourself make like a little mocktail. So you do like some seltzer, splash cranberry juice, some lime juice, whatever. And it helps with like a lot of things. But one thing she said back to me is that she's just trying not to drink too much seltzer because she heard that it erodes the enamel of the teeth.
Yeah, great question.
Is that
So
true?
yeah, so it goes back to any food or beverages that are acidic really aren't good for your teeth and your enamel. So, if you're drinking a lot of carbonated water and the seltzers, it is acidic, so it's not the best for your teeth. I have, patients similar who don't like to drink regular water. I've had patients who started, drinking more juice or putting, flavored powdered in water that's full of sugar, and that is not good either. The amount of cavities after getting into a routine of that sugary intake is not good. So in regards to what are other options, I tell patients, have, if you can, soak like mint or strawberries or cucumbers in water to just make it more exciting, I guess, and
Mm-hmm.
let that soak for a day or two, and it's just a little bit more flavorful, but you're not, putting in a lot of sugar, and it's not, very acidic. That leads me to, lemons, oranges, limes are very acidic too. So the acidity in your mouth, that pH is a lower level. So you'll have a lower pH, it means acidic, and the bacteria thrive in that kind of environment. So
Mm-hmm.
that's why, water is more basic or neutral, and depending if you get like a pH balanced water too, that's really good. But I've had patients that like to suck on lemons or squeeze like a whole lemon in their water. That also can cause enamel erosion, which can lead to tooth sensitivity, and and so on. So
Mm-hmm.
I usually recommend, if you can just maybe flavor your water with natural things, cucumbers, mint, strawberries. You can do orange, and I wouldn't squeeze a whole orange or a lemon in a glass of water, but if you have a big pitcher, and you can have fun with the combinations with that,
Mm-hmm.
that would be better. And plus you're, getting some vitamins from that too.
Yeah, it's funny because I just hear everybody probably like, "Oh my god, but lemon water is so good for you, and it makes speeds up your metabolism." It doesn't, guys. It doesn't speed up your
I know. I
metabolism.
follow someone on Instagram, and every morning she squeezes a whole lemon in a water, and I'm like, I actually messaged her, but she never responded. But I was just like, just be careful, like maybe a quarter of that. And so, because I've had a patient where she'd enjoyed her cleanings, she came in and her teeth are way too sensitive, and we could not. I was asking her all these questions, and I always go into diet stuff, and she came back and she goes, I was really thinking about, because I say, go home, like start logging things. She came back and she goes, I use lemon every single day for the past X amount of years, and
Mm,
figured it out.
mm-hmm,
So,
mm-hmm.
so yeah, that would be my best recommendation. I would, if it means that you're going to hydrate, that's fine, but
Right.
really, water, you just have to alternate or put it in and just make sure, you don't keep that.
Yeah. And I'm glad that you said that, because it really, guys, it really comes down to like, if you're really struggling with your water consumption, I think like having a seltzer every day to help you, if they're not reaching your water, it's going to probably help your mood, your bowel movements, your energy, like your overall health. And so like, it might not be the main thing that you need to be looking at. And like, there are some studies that show like the benefits to like actually putting acid back in your gut with maybe having some lemon water, but that doesn't mean that you have the entire lemon. You just squeeze a little lemon and just have it every day. Like, but it doesn't mean you need to like go crazy with it. So I'm sure like Brittany would agree, it's all about individualized care and like really pick and choosing your battles. Like we can't do everything perfectly. And then when you try to do that, you end up with disordered eating or an eating disorder. Like it's impossible. So pick what's the priority. So if you really are struggling with your oral health and this is, you're doing maybe all the other things and this is the one missing link, then yeah, definitely implement that and see if it makes a big difference and see if it makes a change.
Absolutely. Absolutely.
Awesome. Okay. Is there anything else that you want to add? Or anything else you think the listeners need to know before you wrap up and
Oh my
tell them
goodness.
where they can find you?
There is so many things, but I know, there's only attention span of so much, especially when we're talking about teeth for so long. I can go on for hours, but no, all in all, I would just, highly recommend, whether, if you're looking for a dentist or you're at a dental office, it's so important that, it's not just about the teeth itself. It's the bigger picture. That's how I treat my patients. I always say treat patients, not teeth. It's a comprehensive approach. So it's just so important right now, especially this past year with COVID. They're finding studies too. I just read a paper that they did a study. I think it was like 568 patients that had periodontitis was at a three times more likely to experience more COVID complications, death, ICU, assisted ventilation. So it just goes to show that, it's so important to it's an overall health. It's not just one thing or the other. It's so important to make sure, see your doctors, get in good habits, good routine, and take care of yourself, especially this past year. And if there's one thing, that we've all learned, life is too short. So take care of yourself. You get one life and, make the best of it. So in your search for a dental home, just find someone and ask questions, and not one size fits all. So, everyone's treated differently. So make sure you find the right team for you. So that's a recommendation.
Awesome. I love that. Yes. Self-care is the best care. But where can people connect with you directly? And just remind people where your practice is located again. And then if you have, I think you're like maybe your Instagram handle, like where people can maybe follow up if they have individual questions.
Absolutely. So I'm in Pittsford, New York. So if you're watching this and you're my local area, please feel free to reach out to me. If you are anywhere else in the world and you just have any questions or anything, I'm happy to help. You can, I would say best thing is probably to email me. We can do it's bcdentaldesign@gmail.com.
Great.
And then my website is bcdentaldesign.com. And my social media, I think, is BC_dental design. So there's maybe 4 posts on there because they just started March 1st, but I think it's a great way to connect with the local community and so on. So feel free to follow me, ask me questions. I'm happy to help.
That's awesome. Great. Yes, guys, definitely go follow Brittany. She's amazing and she loves this stuff. So you're not bothering her if you ask a question. I feel like so many people are like, is it okay if I ask you? I'm like, yes. I literally say every day, like at the end of every recording, I'm like, message me if you have any questions. Like you're never bother.
Exactly.
So that's awesome.
All right. Well, when you love it.
Yeah, exactly. Awesome. Well, thank you so much for being here, Brittany. Guys, definitely go give her a follow. If you're not already subscribed to the Tips with Toni podcast, definitely hit that subscribe button. It notifies you when a new episode comes out every Monday, Wednesday, and Friday. Thank you so much for being here. As always, I'm Toni Marinucci, your registered dietitian, helping you get healthy one bite at a time.
Awesome. Or maybe you're up there. I don't know where you are. Awesome.